This is Optimum Health for All. I'm your host, OJ Odia.
Optimum Health for all, for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's Optimum Health, yeah, it's for all.
Now, when we talk about health, we usually say that health is wealth. But beyond that, prevention of diseases and illnesses is usually the best form of therapy. That's what we believe in Optimum Health for All. But sometimes diseases do occur, illnesses will occur, and one will need to go to hospital and get treated. But the cost of treatment is usually very high in many countries, including our own. So, how do we ensure that the cost of treatment is bearable, is affordable, and that treatment itself is accessible? Today, we are going to talk about health insurance because this is one way, in fact, a major way of ensuring that health is available and affordable to the generality of our people. Health insurance is not new, but it is something that this country has taken upon itself since 2004. Today, we are going to talk about health insurance in the Rivers State of Nigeria. And we have the Executive Secretary of the Rivers State Contributory Health Protection Program, RIVCHPP for short, Dr. Vetty Agala. Doctor, you are welcome.
Thank you so much. I'm excited to be here.
Thank you for honoring our invitation. We are in your office, but and you are hosting us today.
Yes, sir.
So thank you for being here and giving us the time to talk to you. So, what is different from the usual health insurance that we hear about? People talk about insurance in general, health insurance also in particular. That well, like every other insurance, they will promise and they will not fulfill their promises. What is different from that with RIVCHPP?
Thank you so much, sir. And really, thank you for coming to hear from us what we are doing at the River State Contributory Health Protection Program. We're different, and you can see our vision is to be the best, to be the #1 health insurance agency in Nigeria. And I mean, we are the last set of people to have started. What is different is that we are a team of committed people, not just that we are committed, but we have the commitment of the governor of Rivers State, Sir Siminalayi Fubara. His Excellency came on board, and within his first year in office, he was able to implement a law that was passed as far back as 2021. What is different with Rivers State Contributory Health Protection Program is that we are passionate about what we do. We're committed to the work. And for us, Health for All Rivers Vision, which is the governor's mandate for us, is a reality. It's not just about numbers, it's about people, Rivers people. And so everything we do, from enrollment process to access to care to claims management, all the entire process of health insurance is done with excellence, such that everyone that is signed up with us assesses the health care that they need of sufficient quality to be effective without really going through the financial hardship of our time. And I think that's what health insurance is about. It's about people really actually being financially protected from the cost of Medicare, which we all know is very high with the inflation and all of that.
Okay, who are those eligible to enroll for this program?
The River State Contributory Health Protection Program, RIVCHPP, runs various projects or programs and plans. One of the plans we started to implement was the Basic Healthcare Provision Fund. And as you know, that's a plan of the federal government of Nigeria, born out of the 2014 National Health Act and being implemented across the country to provide a minimum benefit package of care for Nigerians. And so if we say all Nigerians, 220 something or 309,000 Nigerians, we don't know the population, cannot access that care. And we know that there are people who can pay. So we have decided as a country to say, let this fund, which is 1% of the consolidated revenue fund of the country, be put into a basket alongside funds from donors, partners, and other philanthropies to provide quality health services for the vulnerable population. And vulnerability for us in River State is children under 5, elderly above 60, persons living with disability, persons with certain chronic illnesses that we've taken upon ourselves to put on our plan because of the cost of care for such persons. And then, of course, we've added widows. We added widows because in our rural areas, we discovered that our widows are quite vulnerable and are unable to provide for themselves. Yesterday, we were out on the field and we just found out that there are orphans and vulnerable children who are not less than 5 or up to 60. Yet they are vulnerable, they are orphans. And so as we go on and find vulnerabilities in our context, we take them on our plans.
So we expand that definition, the initial definition of vulnerability.
Yes.
Can be expanded more.
Yes, absolutely. Absolutely. Because for us, we are working in the context of our states. Yes, there's a national program. Yes, they are doing it the way it is or should be done nationally. But we have peculiarities in River State, and we have the commitment of our governor to say these people are important to us. Let's get them on board. So that is just one plan. Now we have another plan for those who can pay but may not be able to pay much. The artisans, the market women, you know, they are earning a living maybe on a daily, weekly, and all of that. And so we have a plan for the informal sector. Basic plan that goes for 15,000 naira per annum. And we christened it.
It's a premium.
It's a premium.
Okay.
Yes. So people will pay a premium to access healthcare, basic healthcare that they need for them and their families. And it goes for 15,000 naira for one individual. Now we christened that plan Simjara because for us, we know that 15,000 is unable on its own to provide a health service, even malaria treatment. You know what I mean? Diabetes, hypertension, for one episode or two, talk more of an entire year. So it's a jara that our governor Sasimnalaye has given, and so we christened that Sim Jara. So that is a plan that we have. Yet we have other corporate plans for small, medium scale enterprises that have maybe 5 and above staff, and they want to key into our health insurance. And we have different plans that suits these different kinds of population. And then there is a formal sector plan for those that work for government, whether at the state level or at the LGA level. So we have plans for different categories of people, people in cooperatives and all that. We need to pause. So we've talked about those who cannot pay, the vulnerable population. We've talked about those in the informal sector. We've talked about some of those in the organized informal sector. Yes. Then you now have the formal sector, which is organized private sector and the public sector. And there are plans for that. Now, our law makes provision for even those in the organized private sector who have HMOs and plans to buy in to the state plan. Okay, so that is ongoing and we are working towards it.
Okay, so how do you incorporate that? So if I have I've purchased health insurance through a health management organization, and I want to utilize your own plan. How do I incorporate my own private HMO into the government plan?
Awesome. So what we actually do is to say, get the minimum. Our plan is the minimum. Every other thing you're doing is top up, because this is a social health insurance scheme. It is a solidarity scheme. Whether you're using it, whether you go abroad to have your health care covered, it doesn't matter, because you can. But you're buying into the state health insurance. And then you have cooks, you have domestic staff that you can pay for. The idea is just to key in, because we recognize that it is a large pool that will make this program to succeed. The premium is so low that if you don't have a very large and unitary pool, we would run into trouble.
Okay, how does it key into the federal government National Health Insurance Act? Is it Authority, National Health Insurance Authority,
yes, sir,
of 2022?
Absolutely. So you would recall that since 2004, the country has been running a health insurance scheme. But that law was flawed in that it was a voluntary law. And so people decided if they wanted to or not. And so you had mostly only the people working with the federal government covered. And little wonder you had the coverage for Nigeria perpetually around 5% or thereabout, even after 10-15 years of implementation. Now, the 2022 National Health Insurance Authority Act is as a result of work that started as far back as 2015, when we needed to look at how to improve coverage. Remember that with 2015 came the Sustainable Development Goals, and it came with Target 8 of Goal 3 that talks about universal health coverage. And so you cannot attain universal health coverage if only federal civil servants are on a scheme, if informal sector has no platform to be on a scheme. And so there was need for the Health Insurance Act to be repealed and amended, and all of that happened, and in 2022, that law was signed as an act. And that puts health insurance on the exclusive list. And so states are now promulgating their own laws, and we've been doing that for a number of years. But with this act, even River State that had a voluntary law has been, will I say, subsumed into the mandatoriness of the National Health Insurance Authority Act. And so for River State, we didn't start with the formal sector. We started with the Basic Healthcare Provision Fund, and now the informal sector has kicked off. And so there is now potential for everyone to actually be under a form of health insurance. And this is happening across the 36 plus 1 states in the country. Okay. And if you notice from the last update from the NHIA, you see that as a country we have moved from 5% because of the contribution of states to 10%, I think, at the moment. And I believe that before the year runs out, we should make significant progress.
Okay. So what is we're talking about the progress. What is the progress so far of RIVCHPP? Yes. Because it started this year. I know it's new. I tried to get the organization together and so on. But how far have you gone in the short time that you have so far?
So far, so good, I would say. And I say this because I have the support of the governor. And not just that, we have a strategic leader as the Honorable Commissioner for Health, Dr. Adeze Chidima Ore. And so the Health for All Rivers vision is not just something of writing and making it plain. It's everyone is looking at it and running with it. And so we started by setting up the office. Of course, we came on board in January. At the end of January, the announcement was made. On the 5th of February, we came into this office. By March, we had done the first set of facility assessment, because we need to have providers that can provide the quality healthcare that we are promising. And so with NHIA directing and leading the process, we had a facility assessment for primary level care and a couple of secondary facilities, including private facilities that will provide referral care. So that has been done. And on the 11th of April, His Excellency Sir Siminalayi Fubara, accompanied by the Deputy Governor, Dr. or Professor Ngozi Odu, did the first enrollment. And so we flagged off enrollment on the 11th of April. And so far, as of today, we are at 51,500 and something lives. I mean, it's real time. We have an IT solution that allows me to see enrollments in real time on my dashboard and access to care and what kinds of diseases and what is referred and all of that. So far we've covered 22 of the 23 local government areas in Rivers State. Bonny, we are in conversations with the local government chairman because Bonny is pretty much hard to reach and a lot of logistics is needed to traverse the ocean. And so we are not doing badly. We have so many deliveries to our credits because we are big on pregnant women and children under 5. As one of the goals of this agency is to see that we have facility deliveries under skilled birth attendants and of course to reduce maternal and neonatal mortality.
Okay, how do you relate to health providers? You relate directly with the health providers or do you go through HMOs?
Now, so we started out by relating directly, and that's because our law provides for us to do our claims and do everything, and we have an IT solution that is end-to-end to do that. So currently we relate directly with providers, but the law also provides for third-party administrators. And so from time to time, we still engage HMOs. Currently, we're working with an HMO and a community-based organization to do a rapid assessment of the informal sector. We had done one on the premise of which we wanted to start, but we felt that a lot had changed in the 2 years from when we did the previous one. And so we're just doing another to see whether anything has changed and if we need to modify some of the policies that we're putting in place. So we are ready to work with third-party administrators because I believe that as the scheme expands, as we bring on board the formal sector, perhaps we may need help in one area or the other. So they are there available for technical support when we need them. But primarily, we are the fund holders and we pay because we don't want a situation where people pay premium and facilities don't get to receive money and therefore are not providing the kind of care.
How reliable is this? How sustainable, is this program? Because it's a government-run and managed program. You receive premium from enrollees and then you dispense as necessary. Now, supposing a new government comes in and they are not so interested in this health insurance scheme, how can this be sustained? You know, because people, for example, if I enroll now, I want to continue to get benefit from this system for the next 10 years, 20 years, 30 years. So I don't want any disturbance in the care I'm getting because maybe a new government comes to the picture. How do we sustain this?
All right, so it's sustainable because I can give examples of states that have traversed 2-3 administrations. So that is why legal structures are important. There is a law that backs this. And there is a law that says that government should do 1, 2, 3 things. And there is a law that makes it possible for a chief executive to manage this. And so for me, as a pioneer executive secretary, my role is to lay a foundation. with the mindset that I would be out of here in a stipulated time and another will take place. So putting structures in place is one of the things I'm big on, so that there's a process, regardless of which governor is on seats, regardless of his interest. And that's why we decided to name our program not just health insurance, but to call it Contributory Health Protection Program. We have a structure where community participation is very important. Yesterday we were at Buguma, and we had a meeting with the Ward Development Committee chairman, and we told them that this is your program. The people are your people. The facilities are within your community catchment. Ensure that community members access the care that they need. And so when you put those structures in place, then they can question, then they can ask you if they're not getting what they need. And there are redress pathways that we have put in place. So structures are in place to ensure that it is sustainable.
So the funders of the scheme, let's say the organizers of the scheme, cannot back away because there are laws to protect
the enrollees.
Okay. So finally, I want to ask a very simple question. How will you convince the average of, we normally say common Nigerian, the average person out there, that this system will work for him or for her, and that it's not like, as we said at the beginning, any other insurance system? Because when we hear insurance, we wonder whether there are no fine prints that we are missing.
All right. So what we are trying to do is to gain the confidence of the people, is to build trust. We got into the market, and indeed it's a market, and found that there is no trust in government-run programs. And I want to say that this administration, if you recall, when the governor was 1 year in office, he did a scorecard, including funding for different MDAs and how much was spent on projects. And so we cannot do anything less than ensuring that we are accountable. When people see that you genuinely care about them and that it's working, the way it is working now, because we have testimonies all over the place. In fact, we have civil servants now calling to say, when is it going to be our turn? And so for us, that speaks to the fact that they have started seeing that it is working. And anyone out there, the best time to start is now. The best time to start is now. And this is an annual thing. So if you keep waiting, for everything to be perfect, you'll be on the lose out, because people will keep benefiting and benefiting and benefiting. And so I call on everyone, Rivers people, I always call on even those Rivers people who are not in Rivers State, that they can begin to adopt their communities, pay for, is a paltry sum, pay for them so that you don't have people going to the wrong places to access healthcare. And put us to test. That's what we're saying. For this 1 year, put us to test, and then you will come back running back to us saying, is this true? Is it for real?
So everybody will be happy.
Everybody will be happy. Government is happy, the people are happy, and of course we are happy. Thank you.
Thank you very much, Dr. Vetty Agala. And I did not tell you, viewers, that Dr. Agala is a health physician. And that is important because, public health people take care of everybody. They are not restricted to one subspecialty or the other. So we are in the right place for this program.
Thank you,
sir. Very much for granting us the audience.
Thank you, sir. Thank you for coming
time around. To be here. Viewers, this is Optimum Health For All. And as we say in this program, prevention is the best form of therapy. This is the time to ensure that you register and enroll for Rivers State
Contributory Health Protection Program. Do you mind if I call out some of our contacts?
Thank you.
Okay, so sorry, Decent. So people need to know that they can access us on social media. I believe this is on social media. So our website is www.rivchpp.rv.gov.ng, and that's rivchpp.rv.gov.ng. And you can find us on Twitter at rvchpp. That's X, on RVCHPP. On Instagram, you can get us as RIVCHPP. We are on LinkedIn and on Facebook as our full names. So please look us up, like, share our content. And then, of course, we have a 247 call center. A couple of numbers I'm sure will be rolling on your screen as you go on. Reach us if you have a concern. If you see something, please say something to us. Thank you.
Optimum Health for all, for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's Optimum Health, yeah, it's for all. Knowledge is wealth, so we pass it on quick. From the food to the mood, we be flipping the script. From gut to brain, everything aligned. When you live that good life, it's a powerful sign. Balance is the mission, got the vision on deck. Cut the stress, no mess, keep the wellness in check. When we thrive, we shine with every routine. Optimum Health, you know what I mean. Optimum Health for all, for all.